It's a great day to talk rehab of frozen shoulders. The big name for that is adhesive capsulitis, and the colloquial, the regular name is frozen shoulder. And that's what happens, is your shoulder gets all jammed up and tightened up, okay? So your arm bone, your humerus, sits in your socket, in your scapula, all right? And then your collarbone comes across the top. When you move your arm out, just let it come up, Mike, just normal, you should be getting the first 30 degrees of motion is just your arm moving in the socket. Then the arm and the wing bone move together until you get all the way up. At the top, there's about a 2-to-1 ratio of arm to wing bone motion. In fact, go look at our functional shoulder evaluation video, and that'll explain all that. Frozen shoulder is when the arm comes up and all of a sudden it gets locked and then it moves like that. If you're lifting it forward, it moves a little bit and then it just moves as a unit. The whole shoulder girdle moves together, and that's why they call it a frozen shoulder. And then a big problem is also external rotation, where you try to rotate out and it just doesn't go, okay? External rotation should be at least 40 degrees to 60 degrees. So that's your frozen shoulder. Like anything else, get an accurate diagnosis on your shoulder to make sure that's the problem, and that your issue isn't rotator cuff tendinopathy or a problem with the joint, the acromioclavicular joint, but frozen shoulder involves the soft tissues and the joint. So, Mike, say out everybody, because now you can take your shirt off. So I'm going to demonstrate what happens in a frozen shoulder. Yes, the joint is tight, but it's from the soft tissues. I'm going to take a small piece of exact stretch kinesiology tape, open up. We're just going to put the tape over the anterior part of the chest, okay? And you can see the tape is nice and flat and smooth. When Mike puts his arm down, you can see the wrinkles in there? That's what happens to the capsule of the joint. When your arm is moving, the capsule has to open and stretch and move. When it's down here, the bottom of the capsule gets little folds in it, okay? And that's called the inferior fold of the glenohumeral capsule of the shoulder joint. In a frozen shoulder, those folds get matted together. So when you try to move, they stretch a little bit, then all of a sudden they don't stretch anymore. They're matted together, they're stuck together, and then the shoulder stays stuck. So how do we unstick it? Well, you got to get in there and open it up. There are only a handful of conditions in the office that when we treat them, we tell the patient, this is going to be painful, okay? Frozen shoulder is one of them, okay? It hurts to work this out, but once you work it out, it's fixed, it's done, and it doesn't come back. Let's show you how we do it. Mike, come on over here, lie face up for me. So we know that the problem is the joint's not moving properly. One of the major areas we have to look at is that inferior fold of the glenohumeral joint of the capsule, which is way up in here. All right, so I demonstrated it here, but the problem's up in here. When the arm shortens, that fold gets stuck. So you got to get in there with your fingers, and with some manual release, you got to hold that wing bone down and move the arm bone up, not allowing the whole thing to move as a unit. I'm going to stand over this way so you can see a little bit better. The other area we have to work on is that subscapularis muscle. The subscapularis muscle runs along the inside of the scapula, the wing bone, up into the arm bone. It's one of your rotator cuff muscles, all right? Allows turning in. So you get your thumb on that really deep, and they'll feel tight bands in there. And then bring the arm out, rotate it as best you can, and up over the head. Now generally I stand on the other end, but for demonstration purposes, I want you to see my thumb. It's way up underneath the armpit, holding that wing bone down, externally rotating and bringing the arm up all the way over the head. That is money for a frozen shoulder. Sometimes you got to use the tips of your fingers and work your way deep into where the wing bone comes around medial by the spine, and work your fingers way in there. So it's pretty aggressive. You also have to adjust, a chiropractic adjustment for the glenohumeral joint. One of the best ways to do that is about 30 degrees of abduction, slight flexion, about 30 to 40 degrees of flexion. That's where the joint is its loosest. It's in its open pack position. So you grab it and then you do some gliding. A to P, laterally, inferiorly. That's to help move the ball in the socket, all right? Once we do a mobilization, and you can tolerate that, we go to a more aggressive adjustment. I like to use a little adjusting block, all right, that creates an inertial force. I'll put it underneath the shoulder, relax the arm. I can grab that humerus, put it in a position where it's supposed to move and it's not, and then we do a little impulse on it, and that causes it to shear and to move. And that's a nice way to get more aggressive chiropractic adjustment on the shoulder. And then, of course, you have to look at adjusting the acromioclavicular joint, where the collarbone attaches to the wing bone, another chiropractic procedure to get that. So we do different types of adjustments, mobilizations to more manipulations for the joint. You got to do soft tissue work for that inferior fold, and then I always finish off with the posterior capsule. I'll do active release on that or a sleeper stretch. Mike, let's show you the sleeper stretch. Right on the shoulder, arms at 90 degrees, elbows at 90 degrees. You got to be right on your shoulder. That pins it down. And then bring the arm over, grab it with the other hand, and give it a nice stretch. Very aggressive for the posterior capsule. We work the anterior inferior fold of the capsule. That's where most of the tightening is, where it gets matted down on itself, but you got to get that posterior capsule because that allows your rotation, all right? And this is a great way to get that done as well. So, when your shoulder's doing this, and it's doing this, instead of doing that, it's time to get it checked, it's time to get it fixed. Manual therapies, a good chiropractic sports doc can do that for you. Don't wait. It's going to take some time, it's going to take some care, but adjustments, therapy, exercises, all together, you can beat it. Mike, good job. Thanks for your time today. I'm Dr. Donald DeFabio, and that's how you beat a frozen shoulder.